Hi, I'm Hannah. I'm one of the doctors here at Menopause Care, and I've got a particular interest in premature ovarian insufficiency, POI, early menopause and surgical menopause. PMDD stands for Premenstrual Dysphoric Disorder, and it's a severe form of premenstrual disorder, which means that it's a cyclical hormone-based mood disorder arising in the second part or the luteal phase of the menstrual cycle. So many women will struggle with premenstrual symptoms where they might feel a little bit irritable or low and can feel a bit fatigued, maybe have some physical symptoms such as breast tenderness, headaches and joint pain. But when these symptoms become severe to the point that they're affecting the ability to function, it would then be classified as PMDD. And PMDD can have a really negative effect on quality of life, affect ability to work, to function well in relationships, both personal, social and at work. So PMDD affects approximately 1 in 20 women. People assigned female at birth, and there are thought to be a genetic association, so we often see it runs in families. But the full causes of PMDD are as yet unclear. What we do know is that it's not a hormone imbalance, but it's an abnormal reaction of the brain to normal hormonal fluctuations. That is the menstrual cycle. So when we're talking about PMDD as opposed to a milder form of premenstrual syndrome such as PMS, it's the emotional and cognitive symptoms that are often the worst. So you can have physical symptoms and they can be quite bad, but actually it's the symptoms of like severe depression, feelings of rage, anger, sometimes suicidal thoughts. These can be really quite debilitating, and women will often say that it's like a light switch has gone off in their brain and they don't recognise themselves for that part of the month. Symptoms then often improve within a day or so of the period arriving, and it can feel like a very Jekyll and Hyde experience. There's no blood test to diagnose PMDD because this is not hormone imbalance. And so the only way that this can be diagnosed is by tracking your symptoms against your cycle for at least 2 months or 2 consecutive cycles. And there needs to be a clear pattern showing that your symptoms arise in the second part of the menstrual cycle and improve when menstruation arrives. This can be slightly complicated by the fact that the menstrual cycle can also lead to exacerbations of other underlying disorders such as, pre-existing anxiety, depression, OCD, as well as physical things like migraine and epilepsy. But this will also be found out when you track, and you can see if there's more of a premenstrual exacerbation of something going on or if this is something different. Of course, things can coexist, but this is why it's important to work with your doctor. At Menopause Care, we can diagnose women with PMDD, and we often see that symptoms do worsen during perimenopause because of the hormonal fluctuations that are part and parcel of that hormonal transition. Women with PMDD are particularly hormone sensitive, which can make it slightly more challenging to find a good HRT regime to suit them. But we will work with women as individuals to find the best regime for them. There is no one size fits all when it comes to PMDD, and so it can be trial and error, and furthermore it can take quite a few weeks to months for things to settle on a new treatment regime. So again, it's important to work with someone who has an understanding of this condition and treats you as an individual. So there's not a lot of research here, but we do see in clinic that there are associations with certain other conditions in women who have PMDD. Women with ADHD or autism appear to be more likely to have PMDD, and I think it's because neurodivergent brains are quite hormone sensitive. I also see that it's quite common that women will have migraine if they have a history of PMDD, and there appear to be genetic links. PMDD improves with menopause because once the primary symptom driver, that is the menstrual cycle, has been removed and the hormonal fluctuations settle, the brain tends to calm down. So post-menopause, PMDD symptoms will hugely improve, but it's important to remember that there can be a residual, ovarian cycle within the first few years post-menopause, but the fluctuations will be far less significant and symptoms do tend to improve. That said, the hormone-sensitive brain remains, and so this means that there can still be challenges associated with, for example, finding the right HRT regime to suit. Furthermore, those women who end up having their ovaries removed as a last resort treatment option for very severe PMDD they'll be placed in a surgical menopause, and this should never be touted as a cure because, as I've just said, the hormone sensitive brain remains, and it's really important to work with someone who understands the complexities of PMDD. But for more information on premenstrual disorders, please head over to the Menopause Care website.